We're back here on Carolina Women. Once again, we're at Custom Audio Video. And you know what we're doing today, which is sort of fun, a little bit out of the norm? We're doing a health and wellness show. Who knew, right?
What?
We talked about nutrition. We're going to be talking about supplements and vitamins, but I'm really excited, Allie, to have you here. We're going to be talking today about exactly what you do. And I have a question. We talked about this before after I left. I know that you work with postpartum. I know that you work with a lot of pelvic floor things. Talk to me about what I can expect at an appointment. I'm oftentimes curious. Are there internal examinations? How do you really determine what my needs are?
Yeah, I think that's a great question. So I feel like in prior episodes on the show, we talked a lot about how we do a full body assessment, our orthopedic assessment. We look at strength, breathing, posture, all those things. But sometimes I do feel like patients are a little anxious about, okay, is it going to be like a gynecologist appointment?
Right.
Is there an internal exam? Do I have to do an internal exam? And those types of things. So first of all, nobody ever has to do an internal exam. It's completely up to our patients, and we always make sure we had consent to do that.
Sure.
However, most of our patients do an internal assessment because it gives us such a great idea of what's going on in the pelvic floor and what's going on in the body. So the pelvic floor muscles are just like any other muscles in the body. They become tight, they develop trigger points. They don't want to lengthen fully, they might be weak. And so the only way we can truly assess that is by doing an internal examination. So we don't use any instruments or anything like that.
Okay.
We just use one digit to assess.
Right.
And it's really gentle, and it's completely put our patients at ease. And we're just looking at the muscles, muscle tone, strength, tightness, those types of things.
And so once I get that overall assessment, do you develop a treatment plan that I do with you? Do I do it at home?
Yeah.
What's the typical length of a treatment plan? And I know those questions are really
Right.
tough. Right.
Right.
There is no typical
And
length.
everybody's different.
Right.
So if we find someone has increased tone or really tight muscles, there are some manual therapy techniques, massage techniques that we would do, again, just like if you had a hamstring strain.
Sure, absolutely.
Right. We also have techniques we'll teach patients to do at home. We have pelvic wands and different things that we will teach our patients to use.
Okay.
Nothing scary, completely comfortable and easy.
Exactly.
If we notice that the muscles are pretty well, they can lengthen, they can relax, but maybe they're weak, well then it tells us that we can start on more of a strengthening program. So it kind of gives us an idea of, oh, what are these muscles doing? Or can somebody coordinate with their breathing? Are they just managing pressure really poorly, and is that why they're having incontinence or prolapse or things like that? So it just gives us a great idea of how we want to treat our patients the best way.
I have a quick question for you. For people who are newly pregnant, okay, is that also a good time to come in? Is that a time to maybe learn how to use our pelvic floor muscles to support a growing baby?
Yeah, absolutely. So we actually see, actually the majority, I would say about 70% of our caseload is during pregnancy and especially pregnancy and postpartum.
Sure.
We have many patients that we see from the early months of pregnancy, throughout their pregnancy, and then after. So we love to see our patients during pregnancy because we can help guide them along to have the best experience possible.
And so go ahead. And what I was going to say is what you really shared and taught us too is that there is no age that is too old to come in for an assessment. And I think, you know, as I've gotten older, different parts of my body are doing different things, whether it's gravity or whatever.
Yeah.
And so an older population is great for you also.
Great story. We had a woman call us last week that watched the show.
Yay!
And I would say I use my words carefully. She's older than, you know, maybe a postpartum.
She's older than 40.
But she said, oh my God, I related to what you said and I would love to come in and see if you can help me. And we are able to help her. So that was really great. So all ages, we treat 20 to 70.
But I think the real gift of that too is that you're very user friendly. Having been to the office and seeing what you do, it really demystifies a lot of things and takes kind of the embarrassment out. Is that a good way of saying that?
There's nothing to be embarrassed about because everybody needs their pelvic floor. Some people are afraid to talk about it, but we are not, and so we just want to make everybody more comfortable talking about it and getting help for things that they need and never feeling embarrassed.
I love that. I really appreciate you coming. It's always a treat. We learn something every single time.
Thanks
Stay
for having
with
us.
us. More to come here on Carolina Women.